Welcome to our first aid lesson. Today we're going to talk about management of wounds. There are many different types of bleeding, but basically, bleeding is the escape of blood from your blood vessels. And bleeding can happen internally or externally, that means inside your body or outside your body. You have three types of blood vessels: the arteries, they carry blood away from the heart; capillaries allow exchange of gases and other materials between the cells of the body and the blood; and veins carry blood back to the heart. So, this is a picture of the arteries, your capillaries, and your veins. External bleeding occurs when a blood vessel is opened through a skin tear, like what you can see on the picture. Now, do not be worried about the pictures that you've seen. They are all not real. They are just probably that someone just put red paint or red ink on the finger. It isn't real blood. And external bleeding is whereby the blood flow is visible and it can be life threatening if the blood loss is in a huge amount. What do we do then? We apply direct pressure. Just like the picture that you are looking at now, you use a sterile gauze or sterile bandage, and then you apply pressure directly on the wound until the bleeding stops. For internal bleeding, you don't see the blood, the visible blood coming out of the body, but you will recognize bruises, large bruises like this. This is what we call internal bleeding. And internal bleeding can be very severe if it's in large amounts. Usually, you will know it's severe when the person is losing consciousness, and it usually happens in a car accident or falling from a high place or being hit by a hard object. Now, for a minor external wound with minimal bleeding, remember, as a first aider, we must first wear a disposable glove. We do not touch blood directly with our hands. And you control bleeding by applying direct pressure. And like what you can see in the picture, you elevate the affected part, you lift it up so that the bleeding will stop quickly. Now, major external bleeding, that means lots of blood loss that you can see. Again, step one is always to wear a disposable glove. Then step two is similar. You control bleeding by adding direct pressure using a sterile dressing, a sterile gauze, or a clean pad. Step three, you elevate and support the injured part above the level of the casualty's heart to reduce blood loss. This really helped. So you let the casualty, as you can see from the picture, the blood loss may come from the ankle. So you lift up the ankle, uh, let the casualty lie down, lift up the ankle so that the ankle is above the level of the heart. This will help to reduce blood loss. And of course, the casualty will need to lie down for you to elevate the injured part. And step five, apply first aid for shock if necessary. Why is this so? Because if there is excessive blood loss, the casualty will go into shock. Now, this shock isn't like, oh, I'm shocked to know that you failed your test, that kind of shock. This is a very serious kind of shock, whereby you will see that the person will have pale, cold, and clammy skin. Clammy means sticky, sweaty skin. Like you can see in the picture here, this person looks really pale, grayish blue skin, especially the lips. The person is feeling weak or dizzy. The person may feel nausea, may be vomiting, or may feel very thirsty. So this is a picture that tells you what will happen to how do you know a person is going to shock. They will also have blurred vision. Now, what is the treatment for shock? To treat shock, first you need to stop bleeding. So do not stop applying direct pressure on where you can see that the casualty is bleeding from, where the wound is. You need to continue to apply pressure. Help the casualty to lie down and keep him warm by covering him with a blanket. Many students have asked me before, where do I find a blanket if it is a car accident? Then I say, use a sweater. If you have a sweater or a jacket, just use it to cover the person. Okay, raise and support the casualty's legs above the level of his heart, like what you have seen in the pictures. Loosen tight clothing. That means if the person is wearing a belt, loosen the belt. Monitor vital signs. Check for breathing. Check for pulse. Okay, and of course, remember this person is in shock due to blood loss. Call 995. You are the first aider. not a doctor. So you need to call 995 for the ambulance. Okay, for major external bleeding, secure dressing with a bandage. That means other than just you applying pressure, you need to secure it with a bandage so that the creep bandage will provide pressure to stop bleeding. And if bleeding continues, apply another layer of creep bandage, and of course, quickly call 995 for the ambulance. Now, sometimes the bleeding is a lot. You want to there is this method of applying indirect pressure for major arteries. If you look at the picture there, you see the four parts of the upper arm and the side of the hips where you can press. This will actually, when you press directly on the major arteries, they will stop bleeding quickly. Okay, when you apply indirect pressure, remember to elevate the affected part again. Casualty must lie down and prepare to apply first aid for shock. And of course, call 995 for the ambulance. Actually, this should be the first thing to do. When you see so much bleeding, call 995 first. Okay, major external bleeding with an object, like for example, a glass piece. Again, number one, wear disposable gloves. Control bleeding by adding direct pressure on either side of the object. Remember, this object is sharp. You cannot touch it, but you can put your bandage slightly around it and then you hold on to it without cutting yourself. Then elevate and support the injured part again above the level of the casualty's heart. Secure dressing with a bandage. If bleeding continues, apply another layer of bandage. And of course, if someone is being hurt, is being injured by a glass like the picture you have seen in the previous slide, you have to call 995. Okay, so this is again what happens if a sharp object has pierced through a person's foot. Bearing in mind that this is not real, it's just a picture that people take pictures like this to show you what to do. You notice that the two creep bandage is actually placed around the sharp object. Okay, this is for palm. You can see we also have this thing on the left called the donut bandage. Okay, and then after that they will wrap around the donut. Okay, this is another way to bandage something if a sharp object has pierced through the skin. Notice the safety pin that the person has used to secure the bandage. Okay, major internal bleeding. That means you can see a huge bruise on the body, but you don't see any visible signs of bleeding. This is quite urgent. Call 995 immediately. And while waiting for the ambulance, monitor vital signs. Is the person breathing? If the person isn't breathing, commence CPR. This is the end. Thank you.